When we talk about the biceps load 2 test, you're putting the patient into 120 degrees of abduction, 90 degrees of external rotation, supination, which is a key part of this test because you can see how supination turns more of the bicep on. And since that bicep runs and attaches onto the superior glenohumeral labrum, that is an important connection. So you put the person in this position where that bicep is going to have a strong pull, and it's not, down here, there's a lot of other stabilizers that can help with it. Up here, the shoulder is in a pretty isolated position to have to work. Now, if that test causes more symptoms as the examiner resists that position, you can say it's a positive bicep load 2 test. Now, you need to cluster this with your other findings because this test is also going to be a position for impingement. They might also have some rotator cuff involvement. And then lastly, we need to make sure that they have the clicking or the popping or other signs of labral tears so that this is truly a positive test. Now the test it'll show positive if they resist there and it's painful. Technically, that is a positive test, but that's where you need to use your own diagnostic accuracy and your own clinical reasoning to make sure that that's positive for a labral tear and that you're going to be getting the patient the next things that they need. So when performing the test, make sure that you're also doing your other rotator cuff tear testing, your shoulder impingement testing, and that you're clustering these findings with other signs and symptoms that might match a labral tear. I hope this helps. This is clinical considerations for the bicep load 2 test.